afternoon, everyone. This is Sayukta from All About Skin Wellness. And today we are going to talk about urticaria, which is a skin-related issue. And to talk on urticaria and how to manage urticaria, we have with us Dr. Devendra Jain. He's a senior consultant. He's joining live with us from Mumbai. And today he'll talk on urticaria and its management. Dr. Jain is a senior consultant at Pratham Skin and Hair Center at Virar and Transform 360 Vasai. He has done his graduation and post-graduation from prestigious institute GS Medical College and Kem Hospital, Mumbai. Doctor has special interest in clinical dermatology, procedural dermatology, and dermatosurgery. So with his expertise today, he will enlighten us more about urticaria and its management. A very warm welcome to you, Dr. Devendra Jain.
Thank you, Sayukta, for these kind words.
So,
and
Doctor,
we'll look forward for an interesting session, because urticaria is a very, common condition, and it really affects the life of the patient, day-to-day life of the patient. Yeah.
Right. So as you very correctly said that it is very common and it affects the day-to-day life of the patient on those who are suffering from it. First of all, doctor, we would like to understand what is urticaria exactly.
See, urticaria is basically, in common language, is known as, it's commonly known as pitta, if you, majority of Indian language in North India and so in Hindi. In Gujarati, this is known as serous. So basically in this, what happens is there is a itching, and that itching can be either because of some trigger factor. So that is known as physical urticaria, or it can be automatically by itself. And the itching causes redness, little warmth, then there is a little swelling, like हमको मच्छर काटने के ऊपर कैसे थोड़ा सा सूजन आ जाता है वहां पर, वैसे उसको hives बोलते हैं. In general English term, it is known as hives. So people get those hives. And then it subsides within 24 hours at that place. So to diagnose urticaria, it is very important to find out if the particular lesion which has appeared after scratching, that redness and little swelling is there, it should not remain there beyond 24 hours at that place. It can come at other places, that is a different issue. But at the same place, if it is remaining beyond 24 hours, then we are not dealing with urticaria. It may be a mimicker, some other condition. So this is how it is. And it can affect right from your head to your toes. I mean, any part of the body. It can cause sometimes swelling also, like lips can get swollen. There can be swelling of the fingers and palms, and on the feet, toes. And this swelling can be something painful also. There can be sometimes mucosal swelling. So there can be swelling inside the oral cavity, like throat, and the airways can, airways can get swollen, and that can be an emergency condition. In that situation, patient should be rushed to the hospital as early as possible.
Okay, so even if it can start from some itching or, things like that, but it can go to become real serious. So we'll talk about it in detail later on, doctor. But first of all, we would like to understand what causes urticaria. क्यों urticaria होता है?
See, urticaria के कारण बहुत कुछ हो सकते हैं. बेसिकली ये एक एलर्जिक रिएक्शन है बॉडी का, और इसमें दो टाइप के अर्टिकेरिया होते हैं. एक इंड्यूसिबल अर्टिकेरिया होते हैं, जिसको पहले फिजिकल अर्टिकेरिया कहा जाता था. और ये इंड्यूसिबल अर्टिकेरिया कैन बी बिकॉज ऑफ से प्रेशर इंड्यूस्ड, मींस अगर किसी ने जोर से आपको पकड़ लिया, आपकी बॉडी पे प्रेशर आ गया, या आप किधर मान लो कोई हार्ड इंस्ट्रूमेंट सरफेस के अगेंस्ट बहुत दबा के बैठे हैं, तो दैट एरिया इज अगेंस्ट प्रेशर. सो वहां पर अर्टिकेरियल लीजन्स आ सकते हैं. इट कैन बी हीट इंड्यूस्ड, समटाइम्स इट कैन बी सनरेज इंड्यूस्ड. तो जो एक्सपोज पार्ट है आपके बॉडी का, जहां पर आपको धूप लगती है, वहां पर अर्टिकेरियल लीजन्स आ जाएंगे. इट कैन बी कोल्ड इंड्यूस्ड ऑल्सो समटाइम्स. नाउ कोल्ड इंड्यूस्ड में क्या है कि ठंडी चीजें अगर आपने हैंडल की, आपने इसको पकड़ा, कोल्ड सरफेस लाइक आइस को अगर पकड़ लिया आपने, तो वहां पर आपको इचिंग सेंसेशन, स्वेलिंग, रेडनेस, ये सब हो जाएगा. Then it can be sometime exercise induced, which is known as cholinergic urticaria. तो उससे क्या होता है, जब आप एक्सरसाइज करते हैं तो आपकी बॉडी थोड़ी हीट हो जाती है, मीन्स हॉट हो जाती है, बिकॉज ऑफ द बॉडी वार्मथ, एंड दैट कैन इंड्यूस ट्रिगर एन अर्टिकेरिया. सो दैट इज वन टाइप ऑफ अर्टिकेरिया. सेकेंड इज स्पॉन्टेनियस अर्टिकेरिया, मीन्स वहां पर कोई ट्रिगर आपको पता नहीं चलता है, वो अपने आप हो जाता है. सो दे आर एक्चुअली एलर्जिक अर्टिकेरिया. नाउ यू कैन बी allergic to anything, like it can be some food items. So commonly in food item, if you see, then these are proteins mostly, and animal derived proteins are the most common causes. So like meat hai, chicken hai, fish hai, egg hai, so these are the animal derived protein. Now second in line comes animal derived proteins में डेयरी प्रोडक्ट्स आता है, क्योंकि वो भी एनिमल से डिराइव होता है. बाद में आप वेजिटेरियन प्रोटीन्स की तरफ जाते हैं तो नट्स आता है, so like cashew nuts hai, aapke ground nuts hai, they can cause urticaria. So these are dietary items which are commonly causes urticaria. Now there can be some chemicals, like usually अगर आप प्रिजर्वेटिंग कंटेनिंग फूड खाते हैं, जो कि रेडीमेड फूड आता है, तो उसमें बहुत सारे प्रिजर्वेटिव्स रहते हैं, जो केमिकल्स रहते हैं, या फिर कलरिंग एजेंट्स रहते हैं. लेकिन जैसे आप चाइनीज खाते हैं तो उसमें यूजुअली इट इज सीन कि रेड एंड ऑरेंज कलर्ड फूड जो रहते हैं, they can induce urticaria because they are putting their artificial colors into it. So there are many causes to give rise to urticaria, but sometimes even pollen hai, animal dander hai, house dust hai, these are things which are there in the environment that can also cause urticaria. So there are many causes of urticaria.
Fair enough. Doctor, can we say that urticaria is a kind of allergy?
Yeah, it is an allergy. Yes, it is an allergic response of the body to a stimulus.
Now, you were, telling that it can go real serious. So how serious or how bad can an urticaria be?
See, that is known as angioedema, actually. So urticaria along with angioedema. Now, angioedema is what? Is a swelling of the particular area. Okay. Now, say lip can get swollen. So it just causes disfigurement of the face. I mean, it doesn't look good. There can be swelling below the eyes, so eye looks swollen. There can be swelling of the toes and feet, and there can be little, if there is too much swelling in the feet, then walking becomes painful. Patient, when they walk on the feet, it becomes painful because of the swelling. So these are minor discomfort. But if there is a swelling on the mucosal surface, as I said, say in the throat, so the airways can get disturbed, and then there is a difficulty in taking breath. And even if suppose the epiglottis gets swollen, then there is a difficulty in eating and swallowing. So these are the areas, if they get swollen and there is angioedema there, then you require immediate treatment, and it cannot be monitored on OPD basis. The patient has to be directly rushed to the hospital and given the support and immediate medication. Mostly in these cases, the medication is intravenous, means you give parenteral medication so that you get faster result. Okay. So, but not very, every patient goes through this, very few percentage of, but then every patient of urticaria should be told about this. If this happens, then they should not wait and contact the doctor and all. They should rush immediately the patient to the nearby hospital and then contact the doctor so that the first aid can be given immediately. Yeah.
राइट इसीलिए बहुत जरूरी है कि अगर अर्टिकेरिया है तो हमें एक डॉक्टर से मिलना चाहिए, संपर्क करना चाहिए, ताकि हमें पता हो कि वो कितना सिवियर हो सकता है. डॉक्टर, ये भी मैं जानना चाहूंगी, क्योंकि एक तरह की एलर्जी है और बहुत आम है हमारे यहाँ कि जब भी इस तरह का कुछ होता है तो सबसे पहले हम केमिस्ट शॉप जाते हैं, कोई एंटी एलर्जन ले लेते हैं और हमें कुछ थोड़ा सा आराम मिल जाता है, और फिर हम उसको उतना सीरियसली नहीं लेते कि हम एक डॉक्टर के पास जाए, एक क्वालिफाइड डर्मैट के पास जाए. आई एम श्योर आपके पास भी कई केस आते होंगे जहां पे पहले ही उन्होंने ओवर द काउंटर मेडिकेशन कर लिया है. इज इट ओके टू डू दैट और वी शुड एक्चुअली गो एंड कंसल्ट अ डॉक्टर?
सी एक्चुअली अर्टिकेरिया में क्या होता है कि दो टाइप के अर्टिकेरिया होते हैं. वन इज नोन एज एक्यूट अर्टिकेरिया. सो एक ब्रॉड क्लासिफिकेशन है. एक्यूट यानी जो जल्दी से हुआ है. सो that urticaria usually resolves within 6 weeks. 6 weeks. So 1.5 mahina is the time when it resolves. Okay, with medication obviously. But if the urticaria persists beyond 6 weeks, then it is known as chronic urticaria. अभी अब पहले दिन से आप नहीं बता सकते कि कौन सा पेशेंट एक्यूट अर्टिकेरिया रहेगा और कौन सा पेशेंट क्रॉनिक में चला जाएगा. Everybody starts with acute only. So there is no way you can judge. Okay. सो अभी क्या होता है कि क्रॉनिक अर्टिकेरिया में अगर पेशेंट इज गोइंग इनटू क्रॉनिक एरिया अर्टिकेरिया एंड इफ यू टेक टैबलेट फॉर जस्ट few days and you feel better, and then after stopping the tablet in few days you can again get the lesions back and then again you take. So this is known as episodic treatment. Means जब आपको तकलीफ हो रही है आप दवाई ले रहे हो. अगर आप ऐसे करते जाओगे तो अर्टिकेरिया becomes more severe, the frequency can increase, okay, and with that medicine it may not respond at that dose also. You may have to higher the dose, sometimes you may have to change the medicine. So it is in chronic urticaria especially, you should not take episodic treatment. यानी जब होता है तब लिया, फिर नहीं हो रहा है तो नहीं लिया. उससे क्या होगा कि वो और chronic होते जाएगा और लंबा होते जाएगा. और ऐसा कहते हैं, there is a study which says कि if the urticaria 3 महीने से ज्यादा 3 साल से ज्यादा किसी को हो रहा है, means if it is more than 3 years, then there is a possibility that person may require medication for lifelong, at least one tablet to maintain that.
Okay.
So it is like, say, any other chronic disease, like say diabetes, okay, like blood pressure. You have to take medication to keep it under control. So to find out all this thing, you have to consult a doctor. Another thing, in acute urticaria, sometimes it can be triggered by infection, especially in children. Okay, any hidden infection in the body. It can be sore throat, it can be urinary tract infection, it can be even dental infection, caries, वगैरह. So that can also trigger in urticaria. Any viral infection also. So if those focuses are there, you have to investigate from the history or some blood tests and then treat them also. Because if that infection is not treated, then the urticaria will keep relapsing. Okay. So it is not wise to self-medicate because you don't know the cause of the urticaria. You don't know how long you should treat and what is the optimum dose a person requires, Right. So it is always better to consult a dermatologist and then accordingly, according to their advice, you should chart your treatment ahead.
राइट. और कई बार बिना सलाह के दवाई लेने के एक तो मतलब जो साइड इफेक्ट्स होते हैं वो तो होते ही हैं, उसके अलावा भी कुछ हिडन साइड इफेक्ट्स भी हैं. जैसे एंटी एलर्जेंस जो पहले आते थे उनसे कई बार नींद आती थी.
yes.
और ऐसे में अगर प्रोफेशन कुछ इस तरह का है, जैसे आप ड्राइवर हैं या ड्राइव आप कर रहे हैं और आपने बिना पूछे ही एंटी एलर्जन खा लिया और आपको नींद आ रही है, तो वो काफी डेंजरस दूसरे तरीके से भी हो सकता है. तो इसलिए बहुत जरूरी है कि हम ओवर द काउंटर मेडिकेशन ना लें. और ये जो पूरा हम सेशन कर रहे हैं, इसका उद्देश्य, इसका ऑब्जेक्टिव यही है कि हम लोगों को अवेयर करें कि अर्टिकेरिया होता है, क्या होता है, कैसे होता है और हमें क्या करना है. डॉक्टर, आपने कहा कि अलग अलग कॉजेस से अर्टिकेरिया हो सकता है. ऐसे में डॉक्टर के पास हम जब जाते हैं, इसलिए भी वो जरूरी है क्योंकि कॉज सबका अलग अलग होगा, तो सबका जो ट्रीटमेंट, लाइन ऑफ ट्रीटमेंट है वो भी अलग अलग होगा. तो क्या कॉज पता करने की कोशिश डॉक्टर सबसे पहले करते हैं, ये इसलिए भी जरूरी है कि हम डॉक्टर से संपर्क करें?
यस, एब्सोल्युटली राइट. एज यू सेड कि जो इसकी दवाइयां होती है वो पुरानी जो दवाइयां होती थी वो उससे सेडेशन होता था, यानी थोड़ी सुस्ती आती थी, नींद भी आती है काफी लोगों को. तो अगर आप किसी ऐसे प्रोफेशन में हैं जहाँ अलर्टनेस इज वेरी इंपॉर्टेंट, और आपने, क्योंकि केमिस्ट को ये सब पता नहीं रहता है, एंड दे इफ यू टेक दिस मेडिसिन एंड देन यू आर एट योर वर्क, then there can be dangerous for you and for the society at large. Okay, so you put in danger yourself and other people also. So that is one thing, you should not self-medicate. Second thing is to find out cause, as you said. So most of the times when a patient goes to a doctor with urticaria history, so first of all they take the history, examine them, they ask in detail everything, कि जैसे मैंने कहा पहले कि अगर अर्टिकेरिया का लीजन एक जगह पर 24 घंटे से ज्यादा है, वो अर्टिकेरिया जैसा लग रहा है, लेकिन अगर वो वहां पर ही 24 घंटे से ज्यादा है तो वो अर्टिकेरिया नहीं है. तो यू आर डीलिंग विद समथिंग अदर थिंग्स लाइक सम ऑटोइम्यून डिजीज विच इज नोन एज अर्टिकेरियल वास्कुलाइटिस. ओके, सो वो पेशेंट नहीं डिफरेंशिएट कर पाएगा. ओके, तो उसके लिए हिस्ट्री लेना, एग्जामिन करना, ट्रिगर फैक्टर फाइंड आउट करना और पेशेंट को गाइड करना कि हाउ टू फाइंड आउट अ ट्रिगर फैक्टर. समटाइम्स क्या होता है कि पेशेंट खुद ही ऐसे ही बोलते रहता है, मैंने ये किया तो ऐसा हो गया, मैंने ये किया तो ऐसा हो गया, मैंने ये किया तो, लेकिन उसमें से एक्चुअल कैसे फाइंड आउट करने का कि यही ट्रिगर फैक्टर है, वो आपको डॉक्टर ही आपको गाइड कर पाते हैं. तो जब आपको ट्रिगर फैक्टर पता चल जाता है, जो काफी कम पेशेंट में ऐसा होता है कि आप पता कर सके कि किस चीज से आपको ये ट्रिगर हो रहा है, तो आप उस चीज को अवॉइड कर सकते हैं ताकि आपको वो एपिसोड ना हो, अर्टिकेरिया का एपिसोड. सो इसके लिए कंसल्टेशन एंड एडवाइस ऑफ अ डॉक्टर इज वेरी वेरी इंपॉर्टेंट.
एग्जैक्टली कई लोग साइलेंटली सफर करते रहते हैं, वो आगे नहीं आते हैं अपनी फैमिली को, या फैमिली को पता तो चल ही जाता है, बिकॉज इट्स नॉट अ वेरी प्लीजिंग थिंग्स। आप कंटिन्यूअसली इच कर रहे हैं, बहुत इरिटेशन होता है। तो ऐसे में बहुत जरूरी है कि हमें उससे राहत मिले, रिलीफ मिले, पता चले कि ऐसा क्यों हो रहा है, ताकि हम प्रिवेंशन भी ले सके। अब अगेन चूंकि हम एलर्जीज पर भी बात कर रहे हैं डॉक्टर, इसके जो अलग अलग रीजंस है जिसकी वजह से अर्टिकेरिया होता है उस पर भी बात कर रहे हैं। बहुत आम है जब भी हमको लगता है कि हमें कोई एलर्जी हुई है, वो एलर्जी मेडिकेशन से भी हो सकती है। अर्टिकेरिया आपने बताया कि प्रेशर की वजह से भी हो सकता है, बहुत ज्यादा हीट की वजह से भी हो सकता है, बहुत ज्यादा टेम्परेचर में वेरिएशन की भी वजह से हो सकता है, बहुत सारी वजह होते हैं। लेकिन आमतौर पे हमारे दिमाग में सिर्फ फूड से एलर्जी है जो हमें लगता है कि इसी से होता होगा, तो हम एक अम्ब्रेला बना लेते हैं। हमको लगता है कि हमें अर्टिकेरिया है, भले ही वो किसी भी वजह से है, लेकिन हम कुछ चीजें जैसा आपने बताया एनिमल प्रोटीन या डेयरी प्रोडक्ट्स, दूसरे जो नट्स है, कैश्यूज है, ये अपने डाइट से कंप्लीटली ओमिट कर देते हैं। हमको लगता है ये हम खुद ही कर लेंगे तो हम ठीक हो जाएंगे। आई एम श्योर यू ऑल्सो गेट पेशेंट्स हु हैव डन दीज थिंग्स। व्हाट्स योर स्टैंड ऑन दैट डॉक्टर?
See, actually, frankly speaking, with urticaria, the patient is already troubled. The quality of life उसकी खराब हो जाती है, क्योंकि ज्यादातर जो ईचिंग होती है वो यूजुअली लोगों को देखा गया है वो रात में होती है, और वो उससे उसकी नींद खराब हो जाती है। तो नेक्स्ट डे उसका जो अटेंशन स्पैन है, ये सब बहुत डिस्टर्ब हो जाता है। वर्क लाइफस्टाइल भी बहुत डिस्टर्ब हो जाती है। तो उसके साथ साथ आप खुद ही अगर डिसीजन ले ले कि ये जो खाने में ये चीजें अवॉइड करनी है, ये चीजें अवॉइड करनी है, तो आपकी लाइफ और डिफिकल्ट बना रहे हैं। और ऐसा मैंने कहा कि जरूरी नहीं है कि हर पेशेंट को फूड से ही एलर्जी है, और जो आप सोच रहे हो वो आप अवॉइड कर रहे हो उससे ही एलर्जी है। सो इट इज वेरी डिफिकल्ट टू फाइंड आउट। ओके, सो ब्लाइंडली अगर आप अपनी फूड अवॉइड कर रहे हैं तो आप खुद का भी लाइफ डिफिकल्ट बना रहे हो, क्योंकि हमेशा आप परेशानी में रहोगे कि इसमें ये है कि नहीं, मैं ये खाऊं कि नहीं, मैं ये खाऊं कि नहीं। तो उससे एक प्रॉब्लम, घर में जो खाना बनाने वाले उनको भी तकलीफ कि आपके लिए कुछ अलग क्या बनाए, so and it doesn't help with all this trouble also. If it is going to help the person, then it is worth taking that trouble.
Plus,
but
you are getting
help.
rid of all the proteins and all the nutrients and minerals etc. as well. जिसकी शायद जरूरत है।
yes, जिसकी जरूरत नहीं है, मीन्स उससे आपको फायदा होगा ऐसा जरूरी नहीं है। अभी जैसे एक उदाहरण के लिए, किसी को मान लो ग्राउंड नट्स यानी सिंगदाने से अगर एलर्जी है ना, और उसने बाकी सब छोड़ दिया, तो क्या फायदा हुआ उसको, है ना। तो ऐसे ब्लाइंडली करके कुछ फायदा नहीं। और जो फूड एलर्जी है ना बहुत कम है, मींस कंपैरेटिवली। सी इफ यू डिवाइड अर्टिकेरिया इन टोटली ना, तो 50% ऑफ अर्टिकेरिया आर एक्यूट अर्टिकेरिया, 50% will go into chronic stage, means beyond 6 weeks. Now out of this 50% which goes beyond 6 weeks, उसमें एक ऑटोइम्यून अर्टिकेरिया भी होता है। सो ऑटोइम्यून मीन्स ऑटो एंटीबॉडीज, मीन्स आपकी बॉडी के अंदर ही एलर्जी पैदा होके और वो आपको एलर्जी, तो उसमें कुछ एक्सटर्नल फैक्टर नहीं रहता है, तो उसमें फूड है या कोई और चीजें आप अवॉइड करके आपको कुछ फायदा नहीं होने वाला है। सो यू आर मेकिंग योर लाइफ मोर डिफिकल्ट अननेसेसरी विदाउट इट हेल्पिंग यू इन शॉर्ट।
राइट डॉक्टर, चूंकि हम फूड एलर्जीज पे बात कर रहे हैं, आजकल बहुत सारे एलर्जी टेस्ट भी होते हैं, और कई बार ऐसा देखने में आया है कि पेशेंट डॉक्टर के पास नहीं जाता, वो डॉक्टर से कंसल्ट नहीं करता, सीधे लैब में जाता है ये टेस्ट कराने के लिए। प्लस दीज टेस्ट आर वेरी एक्सपेंसिव इन अ वे।
यस।
तो लेकिन एक ट्रेंड सा हो गया है आजकल, सबके पास अपना फूड एलर्जी का टेस्ट रिपोर्ट होता है कि मुझे आई एम एलर्जिक टू दीज 50 फूड आइटम्स। नाउ इन प्रैक्टिकल लाइफ 50 फूड आइटम्स से अगर हम एलर्जिक है और उन 50 फूड आइटम्स को ऑमिट कर दे अपनी थाली में से, तो वही जो बात हम इससे पहले कर रहे थे कि विल रिप ऑफ whatever nutrients etc.
True.
तो what's your stand on those allergy tests, वो वाले खास तौर पे जिसमें हम डॉक्टर की सलाह लेते ही नहीं है, खुद से ही करवा लेते हैं?
See, basically, if you see the latest urticarial guidelines, even latest and even few years back when there was guidelines, as a dermatologist in urticaria, in my practice of 29 years, I have never advised from my side any case of urticaria, any so-called these allergy tests. Because it is not recommended and it is not of help and it is not needed at all. Actually, in urticaria, we do very minimum blood tests, that too when it is required.
Okay.
Okay, and that is to rule out two, three things. One is if there is a focus of any infection, if there is some autoantibodies, okay, or if there is some comorbidities means associated with it. That's all.
Okay.
So there is absolutely no need to go for any allergy test. These allergy tests does not help in case of urticaria. It is more helpful in allergic rhinitis and bronchial asthma. Allergic bronchitis or asthma means basically airways का जो disease होता है, you know, नाक से breathing का जो problem होता है, asthma होता है, उनमें थोड़ा सा helpful हो सकता है. But urticaria के case में, even if you are found allergic to so many things, and if you avoid, then also urticaria can happen to you. So it is waste of resources, waste of time, and it doesn't help you again.
Okay. Parul Shinde हमारी viewer है, उनका सवाल है, should I keep a diary or a track of my symptoms in any specific way to help identify patterns or triggers?
Actually, to monitor urticaria, one thing is patient should find out कि doctor will ask you when you go to them कि, you know, कि what time you get more itching. If you have found out any triggers, what makes it worse, okay? And since how long you are suffering. So we can differentiate from acute to chronic, okay? That is one thing. If it is more than 6 weeks, then it has gone to chronic, right? Second thing is how frequently you are getting. Is it, say, very episodic? So we call it acute on chronic. Like some people, you know, they get every 10 days, 7 days we get. Some people, they get it daily. Now in daily also, there are some people who get mostly in the evening and night. Some people get with sleep disturbance. Some people, they don't get sleep disturbance. So little pattern and, you know, not actually keeping a diary. It is very good if you keep a diary. But then everybody is not very much, you know, fond of keeping diary, and they are not very apt to it. Right. But you should know what time it happens. And if you can find out over a period of time, some triggers, particular thing makes it worse. Like say, I gave you example in physical urticaria, it is very easy to find out. Right? Suppose say somebody has catch hold of you very tightly. And when that is released, you find there is redness, swelling, and you feel little uncomfortable there, little itchy sensation, and then it swells up. Then you know it is pressure induced. Okay. Suppose you have done exercise a little bit, you know, you have walked or you have done treadmill or some exercise, and your body has become little heat, and you start feeling itchy. So that is again physical urticaria, which is exercise induced. Suppose you catch hold the ice cube, okay, and then that area gets swollen up, and you feel little itchy over there, and there is a swelling. So you know it is a cold induced. Suppose you are going out in the sun, and the sun exposed areas react. In same as urticaria, there is another sun exposed reaction which is known as polymorphous light eruption, which is different. But here, if you get urticaria type of lesions, which are known as hives, then it is UV induced, means sun rays induced urticaria. Okay. Now in food also, suppose you have eaten some food particular, and it has happened 2, 3 times, 4 times. You have repeatedly seen the same common food item you have eaten, and your urticaria has become worsened. So you know okay, this can be a culprit. So, and next time you can see and avoid that. So these are the ways, you know, little things you can avoid. But you cannot become very skeptical, because then, you know, it will cause stress, and the stress can also induce urticaria. So you should not take it very seriously and, you know, become very possessive about it, you know, very particular about it. Try to find out, if at all, if you find out, tell your doctor, so that, you know, by avoiding that, if it helps you, it is better.
Exactly. Right. And doctor, what is the line of treatment, or what all treatment options are available?
See, basically urticaria are treated by antihistamines. And usually now the guidelines are, as we discussed earlier, there are first line antihistamines and second line antihistamines. The first line are the older ones, which causes drowsiness, and alertness is compromised. So nowadays they are not recommended unless there are certain cases in which we do use, like suppose a person's sleep is disturbed very seriously because of urticaria. Okay. And now these non-sedating antihistamines is not going to help that much, even after giving them, and the patient complains, no, my sleep is still disturbed. So if the sleep is disturbed for a very long time, over a period of days and weeks, his cognitive function is going to get affected. That time, what we do, at night, we do add sometimes these first line antihistamines, which are little sedative, but we tell the patient, this may cause drowsiness, so you have to take precautions, like, okay. Otherwise, the second line antihistamines, which are non-sedating antihistamines, are the treatment of choice nowadays. So we start with suppose a treatment naive patient comes to you who has not taken any treatment. Then we start with a recommended dose first. If after 15 days, we see them again. If there is no response or very minimum response, then we updose the thing, So we increase the dose. Say, suppose that tablet was taken once a day, we make it twice a day. Again, after 15 days, we review the thing. If there is again minimum or no response, then the guideline says you can updose up to 4 times. So you can make the dose up to 4 times. Okay. And with that also no response, then we'll have to investigate, find out some autoimmune cause of urticaria. We may have to add some immunosuppressants. So in India, we use usually cyclosporin, methotrexate sometimes. Okay, so there are different molecules. We can use even dapsone. Some people, they use dapsone and colchicine, and there are other molecules. In very rare cases, in very severe attack of urticaria, to tide over that initial phase and to give relief to the patient, we may use a very short course of oral steroid also, but that is only for 4 to 5 days. And it should not be taken for a very long time, because it does give you immediate relief. But if you keep taking, then your urticaria becomes dependent on it. Then you cannot, wean off the patient off the steroid. And then, steroid long-term use has a lot of side effects.
Right.
So it should be used by a doctor, qualified doctor, under their guidance and under their instruction. Only the patient should take. And for those many days till he or she has recommended you. You should not self-medicate with steroids.
Right.
Yeah.
Right. And doctor, as we are talking about urticaria, we have seen many times patients complain that they are feeling very, fatigued or, tired. And as you also mentioned that their urticaria becomes worse during night. So what is the reason behind it?
See, basically, the reason is the patient, when they come home, they are, relaxed. Their attention is towards themselves. They are not engaged into any other activity, mostly. So that is one reason. Second is there is a sudden change in temperature. So while traveling, suppose the body it is warm and heat, and then they come to home, they remove their clothes and, change the clothes. So the temperature has changed. So that triggers. So if you see most of the conditions which are itchy, means which gives you the sensation of scratching, they are more during night time, because the patient is, with himself or herself. They are not busy in doing some work. So each sensation can be, diverted when you are busy in the work. So during daytime, most of the time patients are busy. So that is the reason, it is more common or more worse during night.
Right. I'll take one more question from Ronak. Her question is, how can I effectively manage urticaria symptoms while maintaining an active lifestyle or participating in sports?
No, if you are having this physical urticaria, which gets aggravated, which is known as cholinergic urticaria, which gets aggravated by doing any physical activity which causes an increase in your body temperature, and then you get urticaria, then ideally you will have to either cut short of that, or avoid that, or you can take antihistamine before that, before engaging into the activity, so that it can prevent your exacerbation of the urticaria. Yeah.
Right.
But Sonia, it should always be done under the guidance of a physician.
Right.
Doctor, yeah.
True. Sonia Singh is asking, can stress or anxiety play a role in triggering or worsening urticaria?
Yes, we already told you.
Yes. So anyways, a person is in stress if he or she is suffering from urticaria. Plus, stress will definitely. It's like a vicious circle, it seems.
Yeah, and that's why in a chronic urticaria, we sometimes do recommend patient to slow down a little bit, take time out of themselves, and do some meditation practice, yoga or something. And meditation does help. Calming of your mind, it does help. Right. Because what happens, the stress triggers all the inflammatory cascade, and that leads to urticaria.
Neha Sharma is asking, how can I differentiate between urticaria and other skin conditions that may have similar symptoms?
I think we discussed earlier, but again I will repeat. Urticaria usually causes itching, then there is little redness, and there is little swelling along with that redness. Sometimes it may be more, sometimes it may be less. And that lesion at that place where it has occurred should not remain there more than 24 hours. It should disappear before 24 hours. If it remains there for 24 hours, you are not dealing with urticaria. But the other lesions can pop up at somewhere else. So you have to be very particular. The lesion should not remain at one particular point more than 24 hours.
Right.
That is very important.
Aman Jain is asking, are there any gender-specific differences in the prevalence or presentation of urticaria in young men?
Not really. I mean, everybody is equally affected. Equally, male, females. There is no gender-specific differentiation.
Now with the skin allergies or urticaria, we are equally, before going to doctor or consulting it, we normally do some home remedies. That's in our, it's like a tradition. So we'll go for some aloe vera gel or something which will, soothe it down or at least give some relief from the itching and the irritation. What's your stand on that?
See, basically what happens in urticaria, if there is a lesion which is appearing and the more you scratch, it triggers more reaction. I mean, the inflammatory cascade gets more aggravated. Okay. So anything which can relieve the itching at the local level can cause temporary relief to you. But ultimately, urticaria is not a localized problem. It is a systemic disorder. It is a systemic disease. So only applying something from up, some soothing agent, it can be anything, that is not going to help you to treat your urticaria. It may reduce the itching of yourself or of the person, or it can stop the aggravation because the itching has reduced. Okay, and that too at the area where you have applied that. Right. So it can appear at some other places. So, and sometimes it is so severe, it appears all over the body. So where all you are going to apply and how.
And then we don't know what's triggering it or what's the cause behind it. We could be allergic to the aloe vera gel itself.
True. Because all aloe veras are not same. So aloe vera is a species actually. And there are, out of those aloe vera, there are some types of aloe veras which are good for your skin. Not all aloe veras, like, people do aloe vera plant in their home and they don't know which species it belongs and uska extract is going to help you. It's not like that.
Okay. डॉक्टर मान लीजिए आज मुझे अर्टिकेरिया हो रहा है, पहली बार हो रहा है, मैं आज नहीं डॉक्टर के पास जा पा रही हूँ, कल या परसों जा पाऊंगी, आई एम ट्रैवलिंग और समथिंग, इमीडिएट रिलीफ के लिए क्या कुछ और किया जा सकता है, क्योंकि वो कंटिन्यूअस जो इचिंग है उससे किसी तरह से बचा जा सकता है?
Yeah, you can take second line antihistamine like levocetirizine 5 milligram. There is no harm in that actually.
Topical application के लिए
topical में you can apply these calamine preparations which causes little soothing. And if there are some trigger factors you have identified, then try to control that. These are the only 2-3 things you can do. Yeah. And as soon as possible, you can seek the help of a doctor.
ये हम बार बार कह रहे हैं कि अगर अर्टिकेरिया है उसे आप होम रेमेडी से खुद से कुछ करके, या फ्रेंड एंड फैमिली जिन्होंने सफर किया है उन्होंने क्या किया, उनका प्रेस्क्रिप्शन फॉलो करके ओवर द काउंटर मेडिकेशन, ये सब बिल्कुल भी ना करें, ये बहुत डेंजरस हो सकता है। और इसलिए बहुत जरूरी है कि आप जितनी जल्दी हो सके एक क्वालिफाइड डॉक्टर से, एक क्वालिफाइड डर्मेटोलॉजिस्ट से भी मिले। कई बार क्या होता है ना डॉक्टर, कि हमारे फ्रेंड या फैमिली या रिलेटिव में किसी ने अगर अर्टिकेरिया से वो गुजरे हैं और उन्होंने डॉक्टर से सलाह ली है, तो हम उनका प्रिस्क्रिप्शन लेके केमिस्ट शॉप चले जाते हैं। तो हाउ
एक्चुअली क्या
डेंजरस
है
कैन
कि
इट बी?
every patient is different. The symptoms can be the same, okay, but patient is different. The type of urticaria is different. Chronic है, acute है, उसके पीछे कारण क्या है, okay. So ये सब फाइंड आउट करना बहुत जरूरी है, और वो एक डॉक्टर ही आपकी मदद से, मीन्स obviously you have to contribute to the information what they are seeking, and then they will come to a conclusion. And prescription हमेशा टेलर मेड होता है, वो उस पर्टिकुलर पर्सन के लिए होता है. अगर मेरे पास 10 पेशेंट आ रहे हैं अर्टिकेरिया के, सबको एक ही टाइप की दवाइयां नहीं दी जाती, क्योंकि सबके अर्टिकेरिया अलग अलग होते हैं, सबकी लाइफस्टाइल अलग है, सबकी जरूरतें अलग हैं. इन सब चीजों को इनकॉर्पोरेट करके एक प्रिस्क्रिप्शन जनरेट किया जाता है. सो प्रोफेशनल एडवाइस को कोई बीट नहीं कर सकता है. अगर आप सेल्फ मेडिकेशन कर रहे हो, किसी की एडवाइस जो नॉन प्रोफेशनल है, आपके कलीग हैं, फ्रेंड्स हैं, रिलेटिव्स हैं, जो भी हैं, उनके इशारों पे या उनके कहने से या उनका कॉपी करके आप कर रहे हो, तो यू आर डूइंग हार्म टू योरसेल्फ. इट्स नॉट गोइंग टू सॉल्व योर प्रॉब्लम. टेम्पररी यू मे गेट रिलीफ, बट means you are not going to treat your condition, you are just going to get relief temporarily.
राइट. एक और क्वेश्चन है प्रतिमा परमार का, प्रेगनेंसी क्या रिस्क फैक्टर है अर्टिकेरिया के लिए? बिकॉज क्वेश्चन इज, कैन प्रेगनेंसी और ब्रेस्ट फीडिंग अफेक्ट द अक्यूरेंस और मैनेजमेंट ऑफ अर्टिकेरिया?
Breastfeeding is not a risk factor, but there are certain few cases, in which during pregnancy, especially in third trimester, you see a condition which is pregnancy-induced pruritus, we call it, and in which you similarly get, swelling, redness, and severe itching. So that can be confused with urticaria. So pregnancy itself is not a risk factor, but certain pregnant ladies do get urticaria type rashes during third trimester of their pregnancy. That is one thing. And second thing is, yes, certain drugs should not be consumed during pregnancy and during lactation. So your doctor is the best person to judge which drugs are contraindicated and should not be taken during pregnancy and breastfeeding. So they will prescribe. When you go to a doctor and if you are pregnant or you are breastfeeding, you should, if suppose the doctor forgets to ask you, it is your duty to inform. It is not for urticaria, for anything. Whenever you seek advice, medical advice, it is your duty to tell them about these things, so that the drugs which are prescribed to you are not harmful to your baby or yourself. Yeah.
राइट. ऐसे भी प्रेगनेंसी के दौरान बहुत सारा हार्मोनल इम्बैलेंस या चेंजेस चलते हैं, और इसलिए बहुत जरूरी है कि जो भी चेंजेस हो रहे हैं उसके लिए हम सेल्फ मेडिकेशन उस दौरान बिल्कुल भी ना करें. सो इफ यू आर प्रेग्नेंट, इफ यू आर लैक्टेटिंग, प्लीज कंसल्ट योर डॉक्टर बिफोर डूइंग एनीथिंग. And before we wind up the session, doctor, any take-home message for our viewers?
The take-home message is urticaria is very common. They say around every fifth male or female in this world, in their lifetime, sometime or the other, are going to suffer by urticaria. So it is 20% roughly. Okay? But everybody may not have chronic urticaria. As I said, 50% will have acute, 50% chronic. Out of 50% of chronic, some people may have autoimmune urticaria. Some people may have to take urticaria medicine to keep that under control for very, very long time. It may be for years, maybe for lifelong. Okay, so that you have to be prepared. Second thing, never self-medicate, never self-diagnose. Okay, all these social media, Google, all these information platform are going to give you only information. They don't give you knowledge. Okay, so there is a difference between information and knowledge. So always subject yourself to professional advice that is in your interest. Then find out, try to remain calm. Lifestyle changes are very important. All these vices like smoking, alcohol can also worsen your urticaria. Have good sleep, good diet, homemade food, and a little bit exercise. Obviously, if it is not contraindicated, if it is not exercise-induced urticaria. And follow the instructions of your doctor rigorously and judiciously. religiously and judiciously. So try to take medicines on time, and that's all.
Right. So don't suffer in silence. Definitely, urticaria will hamper the quality of life. And for that, to maintain your quality of life, do consult a doctor so that you can get relief, you can get treated. Thank you so very much, Dr. Devendra Jain. It was wonderful talking to you as always, and it was a very informative session. Thank you so very much for your valuable time.
Thank you. Be safe and take care, everyone.
Thank you, Doctor. You too take care of yourself. And viewers, thank you for your active participation in today's session. And take good care of yourself and stay connected with us. Thank you. Have a good day ahead. Goodbye.